A medical assistant is preparing to apply a transdermal patch for a patient. Which of the following actions should the assistant take first? And let's just quickly go through all the choices and just see if anything stands out to us. So we have either A, clean the site with alcohol, B, check the patient's medical record for allergies, C, warm the patch between their hands, or D, shave the site if it's hairy. And which of these things seems to be the absolute most important in terms of patient safety? Because remember, safety is always our priority for our patients. So when we see cleaning the wound, checking about allergies, warming the patch, or shaving the area, the one that's the most pressing would be the allergies, because a transdermal patch, as we see here, if you put that on a patient, it is considered like a med administration because a transdermal patch, the patch has medication in it. So it's a medicated patch that's administered through the skin, which is transdermal. So by administering any sort of medication, including a transdermal patch, we want to be aware of the patient's allergies because if they're allergic to anything in the patch, this is going right through their skin and they could have a reaction to it. And that would be the highest safety risk out of all these options. So you want to go with option B here, checking the medical record for allergies before administering the patch. Option A says to clean the site with alcohol, which may or may not actually be necessary depending on how this med the instructions are for this to be administered, but possibly. But that also wouldn't be the most important step that you want to do first, the most important one you want to do first here, so we can eliminate that. Option B, similarly, warming the patch, that's usually not necessary. Maybe certain medications, that's part of the instruction, but that's usually not. And even if it was, that wouldn't be what you want to do first in this situation. And then shaving the site if it's hairy, maybe that would be something you want to consider, or you can consider just using another site where there's less hair there so it'll stick better. But regardless, that's not what you want to do first. The first step is to check for allergies before giving any sort of medication. So we can eliminate option D here, and then we will go with our choice of option B, checking allergies first.